business in modern allopathy. They did not study the system, but they perfect delivery of the system. Whether the system is half-baked, never mind, deliver it properly. Fail to effectively integrate traditional, complementary and alternative healthcare and medicine with allopathy, resulting in a wastage of financial resources. The bill for traditional complementary does not address alternative therapies. That's not a bill for alternative healthcare, no. It's a bill for traditional and complementary medicine. Correct now? So those who say alternative, no law yet. So put alternative clinic, no law yet. So please read this book. Huh? Okay, now let's go into some details and I'll say goodbye because I know you're bored with me already. These are some of the facts and figures. Okay, no easy solution. It's written in this book, health, no easy solution. So, challenge. Of course, when you have a half-baked system, what you're going to solve? You solve 50%, no? Okay, thanks. This is the trouble with electronics. You can't predict what will happen next. Okay, it's all in your book. Health plan was done by these people, you know. Show me who is, Dr. Aziz, were you in that? Were you in that committee? Sorry, reflex has no place in health plan. Yeah. Dr. Said, were you in for integrative? No. You look at the names. All Ministry of Health and Hospital people, scientific officers, engineers also got inside. I was looking for a naturopath. I was looking for a Chinese medicine guy. No. I was looking for integrated medicine people. No. How? Nutritionists don't have. And they developed the health plan. There. This is what we call truth-driven study. The names are all there. I'm sure they'll be very upset with my statement, but no choice. Sometimes truth is bitter, I have to swallow it. So the key point here is, first, we are not sure the biomedical allopathic system is a total healthcare system. It is just an injury, illness system. First, you must make sure your system is correct, your model is correct, your methodology is correct, the science is correct. Then you go and deliver it well. Nothing is done. So they only look at physical parameters. They don't care your mind. Your mind is corrupted, your mind is, roti canai mind, they don't bother. Your mind is nasi kandar mind, they don't bother. Your mind is, Kentucky Fried Chicken, they don't bother. But the mind controls your life. Okay, where is that? Key issues. This is food for thought. Can a medicine system based largely on the physical realities developed for the management of injured and diseased be used for the empowerment and management of wellness of people who are not yet ill or injured? Key question. These are serious things. Sometimes truth is bitter, but this is serious. If we use evidence-based science to evaluate the above statement, because they always say evidence-based, evidence-based. Now we use evidence-based. It becomes crystal clear that there is a very serious shortcoming and oversight in the facts and figures used in the preparation of the country's 10th Malaysia Health Plan. Because they want a health plan, but they ask the injury disease people to do it. It's just like asking the mechanic to train people how to manufacture a car. Mechanic, the car break down only, he's got business. So when people break down only, they got business. But what about preventing illness? Whose business? So, a largely disease-based health plan will focus on diseases and injury, not on how to develop proactive, forecaring help to keep diseases and injuries at the lowest possible level. These are the key issues I'm going to raise. I don't know how you're going to take it. I'm telling very carefully, after careful analysis of the plan, this is the key issues. Okay? Healthcare spending as a percentage of GDP, Malaysia 5%, 40 billion. US 17% of the GDP use, the worst healthcare system ever. Global average only 8%. Why America spends 70% of the GDP? That's why they're struggling with their healthcare problems. Okay. Let's look at diabetes. Sorry, this slide is something not correct. Malaysia has a population of 30 million. This one Dr. Vasantha Kumar will discuss in detail later, but I quickly go through. Prepare your mind for the big hit. Out of this, almost 3 million have diabetes. More than 10% actually, highest in the world, you know. Happy, we have almost 40,000 allopathic doctors. Any facts and figures? 335 hospitals, 24 operating medical colleges, and a budget of 3 billion to deal with diabetes. With these allopathic resources, what has been achieved? Any analysis? The Ministry of Health has reported using HbA1c as a criteria. Using all these, only 15% of the patients have a reading of 6 millimole. What do you say of the science? How many drugs? From glibenclamide to metformin to Avandia to don't know what all now, and then all the insulins in the world, 15% only can be controlled. I am throwing this challenge. Is the science correct? This poor outcome clearly indicates that diabetes cannot be successfully managed by allopathism, however scientific or however evidence-based it is. There is a fundamental flaw in the system of medicine which has not been impartially addressed. Now, where is the weakness, shortcoming, and inadequacy? Quickly, sorry bear with me. I know time. You all came late, so lost time. Overdiagnosis, underhealing. You got CT scan, you got MRI. Oh God, everything God. You got brain tumor, how do you know MRI? Do you have a cure for brain tumor? No. We only know how to diagnose. Yeah, you tell me. So we call it overdiagnosis, underhealing. Over-medication, under-prevention. You saw JSK, right? 3 billion for them is kacang putih, you know, no? Quietly in their private meeting, they were laughing. Only 3 billion, wow, throw it away. Because Zoko alone earns 10 billion. Almost, what a waste. Sorry, too sensitive, Edwin, you got to change. He's like a sensitive person. Go, back. Yeah, no. Okay. There must be a fundamental flaw, almost 100% copying Western medicine. Very proud, you know, I studied in Harvard Medical College. Okay? I studied London School of Medicine, yeah. You studied the medicine, but is the knowledge correct or not? You know how George Washington died, isn't it? He had fever after getting wet in the rain. He had developed flu and infection. So what was the treatment at the time? Please read history of this, very interesting. The time was bleeding, you know. You bleed the fella, thinking there was dirt in the blood, bleeding. They bleed him to death. He died because of overbleeding. The science was not correct, right? But it was perfectly administered to the president. This is what my message is. See? You find out whether there is any flaw in the allopathic system first before telling it is the ultimate. Almost 100% copying without critical value analysis. I am telling allopathy is good, but it has its limits. Don't think it can cover everything. So it's not a complete healthcare science. No faith in our own creative we wait, you know, when the next drug will be developed by the drug companies. Hey, when? Journal, when? Why can't you develop your own? Spending national money for wholesale copying, indigenous medicine dumped and scored and ignored. When I was attending a meeting, they say, what? Oh, your product, you grew in the backyard. See? Sarcastic, skeptical. Your own land, your earth, your country. You don't have faith and trust. Wholesale copying, compliance, waiting for the West to create and then follow them. And subtly become slaves to drug companies. 90% disease and injury management, only 10% health and wellness. Healthy lifestyle and knowledge empowerment, they talk a bit here. But I put there NATO, it's not North Atlantic Treaty Organization, you know. It is no action, talk only. They talk a bit, no action. Show me which hospital is having a fantastic wellness plan. No drug and procedures related to iatrogenics. Drug registrar FDA is a dictator. Even local food-based US FDA is their boss. You want to register food also, you have to refer to FDA. They think for us, we keep our brains without using them well. Little wonder we have 3 million diabetics out of 29 million people. Okay, I may sound not very good for some of the doctors, my apologies, but you think you can refute it? Well and good. What is Malaysia's problem now? All here. First problem, see? Drug abuse, leading to other problems. Then substance abuse, alcohol, tobacco. Then obesity, overeating. People don't have stamina. Tired. Walking up the mountain, they say cannot walk, very weak, tired. Okay. Where's our health gone? High oxidative stress, no damage control. Tobacco, high oxidative stress. Alcohol, high oxidative. Overeating, high oxidative. Chemical drugs, high oxidative stress. No damage control. See, leading to lifestyle metabolic disease, diabetes, all that. Lack of physical activities. Mental and physical stress, family, financial, emotional, relation, all kinds of stress. Problems in Malaysia, I'm telling you. Weak immunity, every month cough, flu, fever. Aging. Now, these are some of the key problems of our country. A health system have to address this, apart from injury, of course. Okay. So, you can read everything there. That's why we need to explore the human being more holistically now. Not just looking at simple things. Why is it my slide like that? Over. Okay. Okay, one all you know, huh? Let me see. Iatrogenesis.